How should we eat for thyroid disease? Interesting about science and medicine, prepared by the editors of website netboleznim.ru. Many of the diseases of the thyroid gland are associated with iodine, more precisely with its deficiency or with its excess. This trace element is actively involved in important biochemical process of the thyroid gland. With endemic goiter and thyrotoxicosis, nutrition with the required amount of iodine is a very important measure, but with thyroiditis, food with a high iodine content should be limited. What is iodine? Iodine is a chemical element with the number 53 according to the periodic table of chemical elements, with an atomic mass of 126. He is content in nature in living organisms, most of all in algae, up to 1% of iodine, and the human body only 12 to 200 milligrams of iodine, 10,000 of a percent. Factors that affect the development of goiter with influence: iodine deficient area, pregnancy, medicine that give a stromogenic effect, protein deficiency, smoking, genetic factors. How to eat with thyroiditis? It is recommended to restrict the consumption of such food product. Cranberry, which contain up to 350 micrograms of iodine per 100 gram of product. Seaweed, which contain up to 100,000 micrograms of iodine per 100 gram of product. Fei Hoya, which contain up to 300 micrograms of iodine per 100 gram of product. Squid, which contain up to 200 micrograms of iodine per 100 grams of product. Cod, which contain up to 135 micrograms of iodine per 100 gram of product, and prune, which contain up to 50 micrograms of iodine per 100 gram of product. What processes are observed in the body with hypothyroidism? It is necessary to there is a risk of edema due to fluid retention, metabolic process slow down, the concentration of cholesterol rise, and a decrease in metabolism of fat and cholesterol is noticed. What is recommended for hypothyroidism? It is necessary to exclude food high in cholesterol and salt for consumption, increase the intake of proteins, reduce the intake of fat and carbohydrates. A diet with a low calorie content of 10-20% compared to that of healthy persons is recommended. Increase the amount of fermented milk products, fruit, vegetables consumed, porridge. Do not abuse with food rich in vitamin A in case of hypothyroidism. Carrot, apricots, pumpkin, liver, butter. What is thyrotoxicosis? Thyrotoxicosis increases thyroid function is manifested by too much production of thyroid hormones. An excess of hormones enhance the metabolism and oblige the body to expend more energy, causing the excess consumption of protein and fats. Minerals required for thyrotoxicosis. The body consumes more minerals such as phosphorus, calcium and potassium, and there is also a deficiency of vitamins. To avoid this disease, it is very important to always consume iodized salt. What to avoid in case of thyrotoxicosis? With thyrotoxicosis, increased excipitality of a nervous system and a rapid heart rate are often observed. So, it is not recommended to eat food that excite the central nervous system and cardiovascular system. Coffee, strong tea, spicy food, chocolate, strong fish and meat, bouillons. Only boiled meat and fish for thyrotoxicosis. Meat and fish are recommended to be eaten only boiled. If you adhere to these rules, then the rest of the rules for processing food are the same as for a normal person. Be sure to observe fractional meals. Eat 5 times a day. Avoid fermentative foods in case of thyrotoxicosis. In the presence of diarrhea to patients with thyrotoxicosis, it is necessary to exclude from the diet food that promote fermentation in the intestine, as well as those that stimulate bile excretion, excretory activity of the stomach, and pancreas. Bread, borscht, steamed and fried eggs, plums, onions, sausage, radish, apricots, garlic, duck and goose meat, grapes, That's all. Thank you for your attention. This material was prepared on the basis of an article from website netbolezny.ru. This material is for informational purposes only. If you're using any methamphetamine, it's recommended to consult a doctor. Subscribe to our channel. Thanks. Bye.